Hello, I'm Dr. Michael Duffy at the Texas Back Institute. Today we're going to talk about spinal instability. What is spinal instability? Well, the way we categorize spinal instability is based on the motion of the spine. The spine is constructed of bones with discs in between. Spinal instability can be created through trauma. It also can be created through degenerative changes over time. What it is an advanced degenerative process that creates abnormal motion in the spine. That abnormal motion, or translation, rather than moving in concert, can cause pain. It can cause back pain, it can cause nerve compression, and a nerve compression will give you pain that radiates into your legs. That's why people commonly seek treatment for spinal instability. So, what do we do when you come and see us when you have spinal instability? Well, the first thing is a physical examination to determine how bad the instability is and neurologic changes. We would get x-rays and we would also order CTs or MRIs to better visualize what the actual pathology or problem is. Then we would come up with a treatment plan. Typical treatment plans start with anti-inflammatory medications, muscle relaxers, and in the rare case you might need some pain medication. Then we would also progress with physical therapy. The goal of physical therapy is to strengthen the core muscles and the muscles of the back to stabilize the spine, and thereby we can reduce the inflammation and reduce pain. Now, if you come to us and you have significant pain radiating into the legs and significant nerve compression, we may start with epidural steroid injections. The goal of an epidural steroid injection is to inject corticosteroid into the space where the nerves are getting compressed. That causes reduction of inflammation, and it also improves the leg pain that you're coming in to see us for. So if all of that fails and we need to progress the treatment because your symptoms are continuing, then we might recommend surgical intervention. There's a number of ways to treat spinal instability with surgical intervention, but the primary focus is to do a fusion operation. Fusion operations can be performed through the abdominal, through the side or the flank, or through the back. Your physician will determine what is the most appropriate procedure to fix your condition and optimize our rates of fusion. After a fusion surgery, typically patients would start physical therapy around 6 weeks. In the first 6 weeks, we would keep them in a spinal brace to minimize motion and minimize pain. Then once we progress through physical therapy to strengthen those abdominal muscles and the back muscles, that's when we can get patients back to life. We can get them back to doing activities such as golf, skiing, tennis, things like that. Typically, patients would progress through physical therapy and we would allow them to return to those activities somewhere between 4 and 6 months. And our fusion rates are approximately 95% for this particular condition. So patients do rather well with this surgery. And the goal is to get you back to your life and get you back to functioning the way you did before this developed. If this is something that you're experiencing, you can call the Texas Back Institute and you can get an appointment with any number of over 20 surgeons that we have board certified in neurologic surgery and orthopedic spine surgery. I myself practice at our Mansfield office and the Dallas, Texas office. Thank you.